коллеги. Добрый день, доброе утро, добрый вечер, в
Good day,
зависимости от
dear
вашей
colleagues.
страны
Good
и региона.
morning, afternoon,
Приветствую
or
вас в
evening,
рамках
depending
региональной
on
инициативы
where
ключевых
you are, which
практических
country or
решений по
region.
ведению
Welcome
механизма
to the key
multisекторального
practical
подотчета
steps
СВО для
to
ликвидации туберкулеза.
MAF-TB
Меня зовут
for
Александра Василенко.
ending
Я
TB
коммуникационный
globally. My
менеджер
name is
Европейской
Alexandra
коалиции по
Vasilenko.
борьбе с
I'm a
туберкулезом,
communication
а сокращенно
manager
мы называем
of
ТБ. И сегодня совместно с моей коллегой,
TB
исполнительным директором ТБ
coalition
Юлией Каланчой,
to
мы будем
combat TB,
модерировать
and
эту
together
встречу
with my
совместной
colleague
встречи.
Yulia
И
Kalancha, we
пока
will be
подключаются
moderating
остальные
this
наши
2-hour
участники,
meeting. And
хочу
as
сделать
our
небольшое
participants are
техническое
joining, I
ревью
want to
о
make
том, как вы
a
можете
brief technical
слышать нас на
announcement
удобном для
as
вас
to
языке.
how you can
Итак, обращаю
listen
внимание, что
to
сегодня у
the
нас есть
meeting
синхронный
in
перевод между
uh,
русским, английским и
the
французским
language you feel
языками. Для
comfortable
того,
in. So
чтобы
we have
выбрать
simultaneous
удобный для вас
interpretation
язык,
to
пожалуйста,
English,
нажмите на
Russian, and French.
"Удобно"
So in order
выберите
to listen to the meeting
"Слушать"
in the language you prefer,
и в
please
нем
click on the
выберите язык,
icon,
который для вас является
on the globe
ключевым.
icon at the
Детальные
bottom of the
инструкции, как это сделать,
Zoom
вы также
screen
можете
and
увидеть в
choose
общем чате.
your language
Я еще раз
there.
приветствую
Also,
всех,
we
кто уже
are posting
подключился на
detailed
второй
instructions
межрегиональной
on
формат
how to do
встреч,
it in
посвященной
the chat.
обмену
So
опытом для
once again,
внедрения и
welcome
адаптации механизма
to our
multisectoriального
meeting
для
to
ликвидации
share the
туберкулеза.
experience in
Сокращенно
MAF-TB
мы еще
for
называем этот
eliminating
механизм по-русски
TB
MAF-TB,
globally.
по-английски
So
MAF-TB.
we call
И
it
серия
this
из таких
mechanism
трех встреч
MAF-TB,
организована с
TB,
Европейской
and we have
коалицией
a
по борьбе с
series of
туберкулезом
pre-meetings on
под
the subject
лидерством
organized by the
глобальной
European
программы ВОЗ по
TB
туберкулезу и
coalition
Европейского
with the
регионального
support
СВОЗ.
and lead from
Я очень
WHO
приветствую
and
эти
WHO
мероприятия в рамках
regional
Всемирной
office.
организации здравоохранения и
This
партнерства с
initiative is
туберкулезом
funded
и
by
финансирование ВОЗ.
WHO in
Французский
the
перевод
Stop
обеспечен региональной
TB
платформой CSOs глобального
partnership from
фонда для
UNOT and
франкофонной Африки.
CRG of
Как вы знаете,
Global
сегодняшняя
Fund
встреча будет
for
посвящена
is
вопросам
actually
укрепления
providing the French
национального многосекторального
interpretation.
механизма координации и
This meeting
обзора,
is
разработки плана
dedicated to
эффективной
strengthening
многосекторальной
the
подотчетности, а также установлению
multisectoral
связей с вооруженными
accountability
силами
mechanisms
Третьим.
and
Во время
establishing
сегодняшней
connections
встречи у нас
with
будет
involved
возможность
ministries and
поучаствовать или
sectors.
вдвоем,
During this
или
meeting, which is
втроем.
going to
Или вы сможете
last
и
for
задать свои вопросы
2
спикерам, и
hours, we
также
are going to
поделиться
have
вашим опытом
interactive
по
sessions,
ведению
and you will have a
ТБ в
chance
ваших
to ask
странах.
questions to
Но
the
прежде чем
speakers
мы
and
перейдем к
share your
презентациям,
country's experience
я хочу
in
с большим удовольствием
MAF-TB.
передать
But
слово
before
доктору
the
Ильбаеву, региональному
presentations,
руководителю по
I want to give
туберкулезу
the floor
Европейского
to
регионального
Dr.
ВОЗ.
Oscar
Уважаемый Оскар, прошу вам слово.
Yedilbayev, Regional Director for
Good
WHO
afternoon and
Regional Office.
warm welcome on behalf of the WHO Euro. My name is Askar Idilbayev. I'm Regional Advisor for Tuberculosis and Drug-Resistant TB in the Regional Office for Europe of the WHO. I'm very pleased to be here today at this second meeting that is focused on exchanging experiences and in implementing the multisectoral accountability framework to end tuberculosis, or MAF-TB, as we are saying. So today we are reminded of our shared ambitious goal to end tuberculosis by 2035. This commitment has only strengthened through the targets set in the UN high-level meeting declarations on tuberculosis, both in 2018 and most recently last year in 2023. Achieving these goals isn't something we can accomplish alone. It will require robust multisectoral collaboration with joint efforts and shared responsibility from all sectors involved. As you know, in response to requests from the member states, World Health Organization developed the multisectoral accountability framework for tuberculosis to accelerate our progress. And this framework is about engaging all stakeholders and addressing the social and economic factors that contribute to tuberculosis. In our region, in WHO European region, comprising of 53 member states, we are working closely with the Global Tuberculosis Program at WHO headquarters and partnering with many partners and organizations such as TB Europe Coalition, that is organizing this important meeting today, to support countries in adapting and implementing MAF-TB. And this process includes piloting of MAF-TB assessments in 5 countries and integrating national MAF-TB plans in each country's strategic plan. And we are also embedding multisectoral collaboration as core component of the national program reviews in our region. So the steps each country takes to advance these efforts vary and will vary on its unique context. So it's essential to identify which actions, whether strengthening coordination, developing a MAF-TB plan, or engaging key ministries or agencies will be the most impactful in each case. Civil society and community involvement is invaluable at every stage of MAF-TB adaptation and implementation. And WHO can support countries in several primary ways. Firstly, by advocating and connecting them with partners, connecting countries with partners who can provide vital support. Secondly, through the global guidance on adapting MAF-TB, developing a roadmap, as being said before, and supporting with implementation. And thirdly, by encouraging countries to engage civil society and affected communities to this work. So the TB Europe Coalition, indeed, and like other civil society organizations that are working in our region, and specifically TB Europe Coalition is a key partner for us, for the WHO, and that is ready to support the civil society organizations in these efforts in our region specifically. And we're also asking countries to incorporate MAF-TB into their national strategic plans and ensure regular progress reporting and funding and support that is coming from the government to this process. So looking ahead, we are excited to deepen our collaboration with each of you and build a strong multi-sectoral response and reinforce accountability at each and every level, from global to regional and local. Thank you.
Уважаемый Оскар, огромное спасибо за ваши вдохновляющие слова и ту
Dear
многолетнюю
Oscar,
работу
thank
по
you
развитию
for this very
multilaтерального
inspiring
партнерства и
words
сплоченности, которое
about the
осуществляет
multi-year
европейские
efforts
И
led by
являясь в каждом развитии
WH
для около
Europe
500
to
видов
control and
организаций
combat and
в
eliminate
гражданском обществе,
TB.
которые
As a
действительно
regional
верит, что благодаря
network,
совместным усилиям партнеров из
TAC
государственного,
really believes
гражданского
that
сектора, международных
sending
организаций, правительств и,
partnership
конечно же,
between
экономических гос,
governmental,
механизм
non-governmental
multilaтеральной
sector,
продуктивности будет набирать
led and
долгообороты и
supported
внедряться
by
в наших странах
WHO,
ежедневно и всего мира.
MAF-TB is going
И,
to
уважаемые
be
участники, дорогие слушатели,
accelerated to the
прежде чем
benefit
мы
of the
перейдем к
countries
первой
of the region
презентации,
and
предлагаю
the
по
globe. And
возможности
before
сейчас
we
всем
shift to the
включить
first
камеры,
presentation,
и мы
please,
сделаем общее
if
фото на
you
каждом об
can,
этой встрече.
switch on your cameras so that we could take a group
Поэтому,
photo.
если вы можете, пожалуйста, включите
Please
свои камеры,
turn
мы
on
будем рады
your
сделать
cameras
фотографию. Коллеги,
and we
пожалуйста,
will
скажите, когда
make
вы сделаете
take a group
фотографию, когда
photo.
мы
And
закончим.
please, colleagues, let us know when
Вы, конечно же, мы
you
по возможности, если вам удобно, вы можете
take the
продолжать быть
photos
включенной
and
камерой.
we will continue. You can keep your
Вы
cameras on
сделали, да,
actually
уже?
if you want.
Коллеги Александра, Олеся.
Uh,
Да, все.
so
Коллеги, спасибо
Alexandra,
большое. Мы
Olesa,
сделали общую
done.
фотографию
Okay,
с
thank you
вами.
so much, colleagues.
И
Now
вы
we have a
можете
group
оставаться включенными
photo,
камерами, если
and
вам так удобнее. Спасибо
you
большое.
can keep your cameras on if you
Огромное вам
prefer.
спасибо.
So
И,
thank you
конечно же,
so
я
much,
благодарю всех
everyone, and of
коллег
course we
на
will be
наших
sharing the
партнерских группах.
photos
И перед тем, как мы
on
будем
our
переходить
partner
к сессиям с
partner
презентацией,
resources.
также
And
небольшое
before we
техническое
start the
объявление о том,
presentation,
как
just
вы
a
сможете
another
просматривать
brief
слайды
technical
презентации
announcement.
на вас языке.
You can actually view
Итак,
this screen
вам
in
необходимо,
your
как
preferred
правило, это
language.
будет в
So
верхней части вашего экрана в
usually
Zoom, выбрать
at
на
the
верхней панели инструментов
top panel
определенные полоски.
of your
При входе на
Zoom
свой просмотр
screen,
вы продемонстрируемый экран.
you can
И там,
choose
после того, как мои
the
коллеги начнут трансляцию на 3
presentations,
языках, вы
the
увидите
screen
презентация на
presentations,
русском,
and
презентация на
you can
английском
see
и презентация
presentation
на
in the Russian language, in the
языке.
English,
Таким
or
образом, вы
the French
выбираете тот
language.
язык,
So by
который вам будет
clicking
удобен для
on the
просмотра,
respective
и
language, you will be
просматриваете
able
на нем
to view
презентацию.
the
Подробную инструкцию
presentation in
встретите в
this
чате, но ее
language.
будет легко
Again, a
продублировать
detailed
в
instruction
чате.
of how
И
to
там
do
все,
it you
все
can find
технические
in
будут
the
возникать
chat.
проблемы или
We will
вопросы.
be
Прошу вас
copying
записать
it
в чат,
on
мы
and on.
обязательно
And if you have
их
any questions,
отреагируем и
please write
ответим
your questions
как
in the
будет
chat,
подходящее.
and we will
Кроме
try
того,
our
просим
best
всех
to
участников
quickly
не
respond to your
подключать
questions.
ваши собственного
And please, dear participants, don't try sharing your screens yourselves, because then we will be actually watching your desktops, your computers. That's why it will be seriously interfering with the slide presentation. So if you want to share something, ask a question or make a comment, please do it during the interactive part of the sessions. And now over to Dr. Seyhat Hasanova, technical specialist of the joint program on TB, HIV, and hepatitis of WHO Europe, who will remind us of the 10 key steps recommended by WHO to introduce MAF-TB mechanisms in the countries. So, Dr. Seyhat, over to you. Thank you, Alexander. Can you hear me? Thank you. Good day, dear partners, dear friends, dear colleagues. Very glad to see you. Today, I will very briefly present an overview of the 10 practical steps for MAF-TB implementation, which is actually the multisectoral accountability mechanism for tuberculosis. You remember that at the previous meeting we spoke in very much detail about every step, so now we decided just to make an introductory overview of this 10 steps before you start the detailed presentations. These main 10 steps are presented in MAF-TB guidance and guidelines developed by WHO. And if you want to get some more detailed information about these 10 steps, you can actually try to access the recordings of our previous meetings, or just have a look at the WHO guide. So first step is to enable a conducive environment to initiate MAF-TB at national local level, including close engagement with civil society. And Seyhat's microphone is muted. Sorry.
Включите, пожалуйста, себе звук.
О, до сих пор не было слышно?
Oh, I'm sorry, couldn't you hear me before that? No, we could hear you, but for a second you were muted. So, thank you. I'm sorry, and again, let me know if I have any technical problems. Okay, it's all fine. Thank you. So next step is to undertake a MAF-TB baseline assessment, which is a very important step, especially for the countries that have never had any assessments whatsoever. And there is a special WHO guideline for baseline assessments, and the countries can adapt these guidelines to the country context, conducting either a full-scale baseline assessment or include the baseline assessment into the routine review programs conducted by WHO in the country. Step 3 is set up or strengthen a national multisectoral coordination and review mechanism, again, depending on the country context, because some countries might already have a coordination mechanism and they have to strengthen it to maybe expand the mandate of this coordination committee to include MAF-TB. And countries that do not have such a mechanism need to actually establish it. Step 4 is establishing links with sectors and ministries beyond the health ministry, including interaction with the private sector. And as you remember, we said that in order to have all these agreements with the sectoral ministries, we need to really very clearly identify the roles and responsibilities of each sector and develop some mechanisms for evaluating the efficiency and effectiveness of multisectoral interaction. And actually, the WHO guideline also includes an annex with some examples of such schemes of cooperation and roles and responsibilities, typical roles and responsibilities of different sectors and ministries beyond health. Step 5 is to develop a MAF-TB component or implementation plan at the national level. And that means that countries either can have a standalone MAF-TB plan, implementation plan, just actually setting out goals to strengthen all the MAF-TB components, or such a plan could be a component of already existing national plans to combat TB in the country. Step 6 is strengthening advocacy and resource mobilization for national MAF-TB implementation. This is also a crucial step, targeting awareness raising about this framework and strengthening the accountability. We spoke about strategic advocacy, targeting different target audiences, and we also discussed resource mobilization. And as you remember, we said that this could be internal resources, but not only resources within the whole health sector, but also resources of other sectors or external resources mobilized to ensure MAF-TB mechanism. Step 7 is to promote universal health coverage and address health-related risk factors in national MAF-TB implementation. And as you remember, we listed several potential activities that could be implemented to at this step, like for instance, improve access to TB services through decentralization of TB services and the integration to some other health-related programs. We also spoke about ensuring the quality of services and some other activities. Step 8 is facilitation of equitable access to ethnical, people-centered, rights-based TB services and addressing the key drivers of the epidemic. And we discussed that countries need to conduct reviews and revisit national legislations to eliminate discriminatory policies and provisions, and also need to identify the social and economic determinants for TB. And step 9 is regular monitoring and reporting on the implementation of national MAF-TB mechanisms, and we discussed the reporting from the health sector, which is more or less well organized in all the countries, but also accountability and reporting from other sectors or other stakeholders, be it communities, civil society, or other ministries that can be considered as stakeholders for Stop TB or elimination of TB generally. And step 10 is periodic reviews of the multisectoral TB response. So we do have some coordination with different other sectors. Sometimes coordination is lagging behind, but such periodic reviews globally actually give us the overall picture, and these reviews can be either internal or external, conducted either by national bodies or WHO or with WHO support. And of course, these reviews should be conducted at a very high level to ensure adequate reporting and accountability. So, like for instance, this could be annual reviews, periodic annual reviews that are then discussed at high-level meetings conducted annually to review and discuss the steps already made to control and eliminate TB. And some of these steps can be implemented at the same time in parallel, and the major message is that in order to have a successful and efficient implementation of MAF-TB, all these 10 steps should be in place, should be implemented. That's it. Thank you very much. Thank you, dear Sarah Hart, for this very important introductory overview of the main steps for MAF-TB adaptation. And now we can actually discuss some practical examples of how these key steps are implemented at the country level. Specifically, steps 3, 4, 5, and 6, developing the plans to eliminate TB and other socially dangerous diseases on the example of Brazil, and over to Dr. Ferreira, who is National Consultant of the National TB Program under the Ministry of Health of Brazil. Over to you, Ms. Ferreira.
Thank you very much. Good morning, everyone. My name is Melizane, and I am a nurse and a public health specialist and technical consultant for the National Tuberculosis Program of the Ministry of Health in Brazil. So on behalf of our team, I'm grateful for the chance to share Brazil's experience in establishing an interministerial committee and a linked plan for TB elimination and other socially disease involving parliamentarians and implementing steps 3 to 6 of the MAF-TB. Next, please. So let me start by providing some context on our epidemiological scenario. In 2023, Brazil reported around 84,000 new TB cases and 5,900 TB-related deaths. Nearly 30% of cases are among high priority populations at great risk due to illness or social vulnerability. TB predominantly affects young men who identify as Black or brown, highlighting the intersection of gender, social class, and race on TB-related inequalities. In summary, although TB affects the entire country and free prevention, diagnosis, and treatment services are available nationwide, the disease remains concentrated in large urban centers, presenting unique challenges related to housing, work, and live conditions. Next, please. This is the map of Brazil. Okay, thank you. The next. So despite free TB care in Brazil, 48% of TB patients face catastrophic costs, with income loss and no medical expenses making up over 90%. This underscores TB's severe economic impact, reinforcing that TB not only thrives in, but also perpetuates poverty. Next. Universal healthcare and social assistance are historic achievements in Brazil, established as citizenship rights in 1988 Federal Constitution. Our healthcare system, known as SUS, ensures universal access, inspired by the Alma Ata Declaration, which views health as not just the absence of disease, but also the right to housing, the water, education, and work. Next, please. Next. Okay, thank you. And a strong national TB program is essential for implementing the MAF-TB components. Brazil has over a decade of experience in strategic tuberculosis planning, supported a robust monitoring and reporting system, and a commitment to social participation with its unified health system. In addition to social protection, the program prioritizes multisectoral coordination, particularly for high-risk populations and scientific development. This effort has been a strategic focus since 2017, leading to the establishment of an interministerial committee in 2018, which includes partnerships with key collaborations, For example, the National Penitentiary Department, the Ministry of Social Development, the Ministry of Human Rights, etc. Recently, we have made significant progress in multisectoral initiatives with the creation of the Interministerial Committee to TB and other socially determined disease, and the launch of the Health Brazil Program Interministerial Committee on Climate Change. Next, please. In 2016, the Americas Parliamentarian Front for the Fight Against Tuberculosis was created, facilitating the creation of working groups to monitor the National Tuberculosis Plan and oversee government policies on poverty-related disease. Through this front, members have actively participated in the Global TB Caucus, which brings together parliamentarians from around the world engaging in TB control, and various public hearings on TB. In the last 2 years, we have seen the formation of the External Commission for Developing Proposals to Address Tuberculosis, aimed at elimination TB as a public health issue by 2030. This includes the involvement of parliamentarians and members of the Brazilian delegation at the second United Nations high-level meeting on ending tuberculosis. Next, please. Regarding step 3 of MAF-TB, the International Committee has launched a national initiative called Health Brazil Program. This high-level program aims to translate intersectoral strategies and recommendations into actionable frameworks, progress from national to subnational levels in intergovernmental action, implementing field projects that deliver results where people live. Currently, the program is in the final planning stages, with operations set to begin in 2025, starting with pilot in 5 of 175 selected priority municipalities based on disease overlap. Next, please. The Health Brazil program involves 14 ministries, civil society participation, and other partners structured around 5 pillars, like addressing hunger and poverty, reducing inequalities while promoting human rights and social protection, enhancing communication skills among key stakeholders, including civil society, supporting science, technology, and innovation, and finally, strengthening structure for water, sanitation, and hygiene. Next, please. This slide contains the same information I mentioned about the 5 pillars of Health Brazil. Next, please. Okay, thank you. To advance step 4 of MAF-TB, significant progress was made in 2023 in developed tools for multisectoral coordination. Key initiatives include an interministerial committee focusing on eliminating TB, 10 other diseases, and 5 vertically transmitted infections influenced by social determinants, and an interministerial committee on climate change involving the Ministry of Health. Brazil is committed to the Sustainable Development Goals, and the creation of these committees reflects the government prioritization to health, such disease elimination and climate change as public health priorities. Next, please. Okay, about the step 5, we developed and tested a methodology for a national MAF-TB based review mechanism through a pilot project led by an external consultant with Barro support. This project analyzed MAF components related to commitments and actions using epidemiological data and reports from the National Tuberculosis Program of Brazil. The desk review was crucial for information gathering, followed by 4 virtual focus groups with national and local TB response managers, the civil society representatives, and TB researchers. A MAF-TB checklist was used to capture participants' insight on implementation. The responses regarding progress on commitments and MAF-TB component implementation were used to create a final assessment matrix. Next, please. In step 6, the pilot project testing the methodology and received positive feedback, demonstrating its relevance and acceptance. The external consultants coordination enhanced the entire process, promoting greater autonomy and transparency in the review. An assessment matrix was used to collect and organize all information, proving effective in summarized contributions from the participatory process. Qualitative analysis of focus group recordings provided detailed insights into participants' comments, improving our understanding of various perspectives. Looking ahead, the final report will be submitted to existing social councils and will be published as an important advocacy tool for civil society and other stakeholders. Next, please. So, from Brazil's experiences, several lessons have been learned. First, it is essential to establish measurable indicators of social vulnerability. Second, securing high-level political commitment is a game changer. When leaders prioritize TB control, it mobilizes resources, attention, and action across all sectors. Third, having a robust capacity within the NTP program for planning and monitoring is crucial, as effective management ensures successful for implementing of strategies and tracking of outcomes. However, there are also significant challenges. Resources are needed not only with the health sector, but also across other ministries, as a comprehensive approach is vital for addressing the complex nature of TB and its determinants. Additionally, second, navigating the interministerial relationship can also be complex. Understanding the roles of the executive office and fostering collaboration between other sectors is essential for effective implementation. And finally, determine when, who, and how much data analysis is needed presents a significant challenge. Establishing clear frameworks for prioritizing data collection and analysis is necessary for informed decision making. Next, please. Okay, thank you all for your attention. This concludes my presentation. Thank you.
Огромное спасибо вам, уважаемая госпожа Феррейра, за
Thank
то, что
you
поделились
so much,
уникальным
Dr.
опытом вашей
Ferreira,
страны.
for
Мы
sharing the
убеждены, что
unique
другие
experience of
страны и
your
регионы вполне
country.
могут
We are
взять
sure
его
that
за
other regions
пример
and
и
other countries could use your experience as an example, adapt it to their country context, and make a beneficial use of it. Thank you for this great presentation, dear colleagues. Now we would like to have a brief interactive session, and you can ask questions about what you have heard from the beginning of our session, or maybe share your comments, or even very briefly share your experience in terms of implementing these steps to implement MAF-TB in your countries. Please raise your hands and we will give you the floor. And you can also write your questions in the chat.
I don't see anyone who's raising their hands or posting questions on the chat. Maybe there will be some interventions from the floor. Yes, we understand that probably the participants are still digesting the information that was presented, but I also see that there's a hand that was raised just now. Yes, I see the one from Dmitro. Please go ahead, switch on your mic and proceed with the question. And also, please make sure to introduce yourself and the organization and the country that you represent.
My name is Dmitro Sergeyko. I am general practitioner and I am working in Ukraine like a general practitioner. I want to ask, presentation about social support. What kind of social support, and it is like from government, or it's like donors, or what kind of support do you prefer in your country? Thank you so much.
Это вопрос спикеру из Бразилии, правильно?
Yes, yes.
That is the question to our speaker from Brazil, right? Yes, it is.
Okay, sorry. Can you repeat the question, please?
I can write. Okay, I can write.
Okay, thank you.
Нет, Дмитрий, скажите, чтобы
No, Dmitry, you might as
вам
well
не сложно,
just
повторите.
speak out if you don't mind.
Yes, of course, I can repeat. What kind of psychosocial support do you provide in Brazil?
Okay, what kind of support, okay, in Brazil? About your question is about the Health Brazil, the program Health Brazil, because the Health Brazil program is a program that is being piloted in 5 municipalities, starting with the state of Roraima. And currently there are no additional funds for financing this program, and the budget of the already involved ministries is being used about this high-level program related to the MAF-TB.
So, Melissa, and maybe you can clarify what social protection
Okay.
initiatives he's asking about. Social protection, what benefits are being provided as part of MAF, and also who funds it. So, if you could clarify, thank you.
Okay, thank you. Sorry. In Brazil, we have the Bolsa Família program. It's a governmental program that provides some money for families that affected by disease, especially the TB, and it's funding by the governmental Brazilian, the Brazilian government. And there are other social protections programs. Some are sensitive TB, or others other are specific TB programs. Bolsa Família programs is a sensitive TB program in Brazil. And other programs like specifically TB, it's like vouchers for food or for transport. And these type of programs are not funded by the government, are funded by local contacts, for example, for municipalities, other cities. And the only program funded by the government that affected TB, people affected by TB, it's the Bolsa Família program. Okay.
Спасибо большое, Мелисана. Я думаю, что
Thank you,
Дмитрий,
Melisana. I
вы
think
ответили в полной мере на вопрос
Dmitry
Дмитрия.
got
Есть ли
his
еще какие-то
answer.
вопросы у коллег?
Are there any other questions?
Сейчас у вас есть уникальная возможность для
Because
обмена
you now
опытом,
have this unique opportunity
для
to
того,
exchange
чтобы
experiences,
узнать
to
у
exchange
коллег из
insights,
Бразилии, каким
or
образом
to
они
ask
внедряют
our
MAF.
colleagues from Brazil about their
Пожалуйста, если
implementation
есть
of
еще какие-то вопросы.
MAF-TB.
Я вижу, что в
I
чате есть
see that there are
вопрос.
questions being posted in our chat.
Сейчас, одну секунду. Я, наверное, прочитаю сейчас. Я вижу, у Саяхат есть тоже
I also see
вопрос.
that
Саяхат, пожалуйста, мы
Sayahat
сейчас
has
с чатом
a question.
посмотрим, какие
Yes,
вопросы
let me
есть.
just have a look in our chat,
Саяхат,
just to check
пожалуйста, у
it
вас
for the
рука
questions.
поднята.
Sayahat, you have a question, right?
У вас очень плохой звук, Саяхат. Можно громче, пожалуйста?
For this excellent example. and it actually shows many steps of MAF-TB adaptation and implementation. My question is, you mentioned about the interministerial committee, which is dedicated to tuberculosis, and another one on the climate change. But my question about the interministerial committee on tuberculosis, who is the head of this committee? Because it's very important to have a very high level. Yeah, I wonder who is the head of this committee. Thank you.
Sorry, Sayota, my connection is a little bad. Can you repeat your question, please?
Yeah, my question is, who is the head of the interministerial committee on tuberculosis?
Okay, thank you. The head of this program is the government of Brazil. We have a partnership with other ministries and from parliamentarian in Brazil. So the head is the government. But sorry, the head is government, but it's leading by the Ministry of Health.
Thank you.
Мелисана, спасибо большое. У нас есть в чате,
Thank you, Melissa.
во-первых,
We,
благодарность за ту работу,
first of all,
которую вы
have a
делаете,
few words of
наши
gratitude
участники,
for your
и вас
good
поздравляю с
work,
такими успехами,
and we
и
have people congratulating you
поздравляют
on your
особенно
successes.
и отмечают особенное
And people are
вовлечение
writing
в
that
многосекторальность
it's equally
именно
important that you
парламентариев. На этом делают
involved
акцент.
parliamentarians for
И
this
я
multisectoral
вижу,
approach.
что Дэнни
And I
Health
see
с
that
ником Health for Prisoners. Пожалуйста,
that Danny from
вам
Health for
слово.
Prisoners has a hand raised.
Дэнни,
Danny, yeah,
пожалуйста, вам слово.
Danny, you have the floor.
Allô, bonjour tout le monde.
Hello,
Мы вас
everyone.
слышим.
We can hear you.
Oui, en fait, merci
So,
beaucoup pour la
thank you
parole. Je
so
ne sais
much
pas
for the
si
floor.
vous me captez très
I don't
bien.
know if you can hear
Je
me
viens de la
very well.
République démocratique
I'm
du
speaking
Congo
from
et
DRC.
je suis de
I
Health for
am
Prisoners,
from
qui
Health
est une
for
organisation
Prisoner,
une organisation qui
which is an
travaille pour lutter
organization
contre la
working
tuberculose en milieu carcéral
to fight
dans le
against
pays.
TB in
Et je voulais
prisons.
savoir,
I would like to know,
par rapport, je ne
I
sais pas
would
si
like
vous
to
me suivez.
know. I don't know if you can follow me.
Oui, Damien, on te suit.
Ok,
Oui,
merci.
oui.
Okay.
Je voulais savoir, avec
So
l'expérience
I would like to know with
du
the
Brésil,
experience of Brazil,
la fonctionnalité au fait de ces comités multisectoriels.
how does those
Comment ils arrivent
multi-sectorial
à
committees work?
mobiliser
Are
les
they
ressources,
able to mobilize
au
resources?
fait financières
Like
qui
how
est,
are they able to mobilize
en
financial
termes
resources,
du personnel
or
et
mobilize the human resources needed for
par
the
cette
function of the
mobilisation
committee? And
financière,
also
est-ce que c'est
for
seulement le ministère de
financial
la Santé ou c'est
mobilization,
par
is
quel
it
mode
the
de financement
responsibility of the
que c'est
Ministry
fait au
of
niveau
Health?
du
What
Brésil?
is the
Si c'est le
financing
gouvernement seulement
mechanism
à
in place? Is
travers
it only the
des
government
activités
through
du ministère de la
the
Santé
activities
seul
of the Ministry of
qui
Health
est
that mobilize
réparti
resources,
ou soit des activités sont
or
étendues dans d'autres
are there
secteurs ou chaque
financial
secteur
mobilization activity for each sector,
aussi un
or
plan intégrant les activités
each
de lutte
sector
contre
has to
la tuberculose
integrate
dans leur
the
ministère
activities
et
of
prise en compte.
tuberculosis in
Je ne sais
their
pas comment
planning? So I would like to know like
les choses
how
sont managées
you
à ce niveau-là.
manage the
Donc en même
mobilization
temps,
of
il y a cette
resources.
mobilisation de
There is
ressources,
this
mais en
part of
même temps, cette
resource
intégration
mobilization, but there's also the need
des
of
activités ou des
integrations of
TB
activities
dans
or
ces
TB
différents
services
secteurs
in the
pris
different
ensemble.
sectors.
Comment
So how do
ils
you
avancent
also
et comment
ensure the
quel est aussi
integrations
cet
of
impact-là?
services in
Merci.
all the different sectors? Thank you.
Thank you very much, Danny. Okay, you said about the committee, the financing of the committee, right? Of the MAF or of the Brazil Health Program?
It's the MAF, Melissa.
C'est par rapport
Okay,
au
it's
MAF.
perfect. Okay, and Brazil, the MAF adaptation in Brazil was carried out through a project funded by the PAHO in Washington. And to do this, the national program in Brazil hired an independent consultant from a university in Brazil who conducted the process. But the funding is from the funding of the MAF. It's from the PAHO in Washington, okay? And the goal is to broaden participation through a more inclusive approach, okay, by the MAF, which virtual stage and in-person stage where civil society representatives are elected by their peers, for example, and can be contribute with the MAF instead of being appointed by the national program. All of this is from the national program, as was the case in the pilot. And the planning, the planning, it's that evaluations will be conducted in a spanned way every 2 years in Brazil, particularly in the mid-end and end phases of our national plan to ending tuberculosis. For example, during the 2026 to 2030 phase. These evaluations are scheduled for 2027 and 2029 to provide input for the next planning cycle, okay? And about the having in-person stages and the participation of the civil society representatives in this committee, the purpose is, I think, is to ensure a more democratic and representative participation from this committee in MAF, enable civil society members elected by their peers to contribute to the entire process, promoting greater inclusion and legitimacy in the plan's development. Okay. I don't know if I if I was clear about your question. But in summary, the MAF. Yeah,
Oui,
but
j'ai une réponse par rapport
Yes, I would like to have
modèle de
an
financement
answer on the
du
financing
MAF, mais
model of
aussi
this
donc je voudrais
MAF
avoir
project.
une idée sur
And I also would like to have
l'intégration
an
des
idea
services
on
dans
the
les différents
integration of
ministères.
services in the different
Est-ce que
ministries.
le ministère qu'on a
So, for
identifié,
example, the
quels
different
sont
ministers that you've mentioned,
les ministères
um,
qui
are there
peuvent
ministries that have
intégrer ou mettre en
specific
œuvre certains
activities of
services dans leur
MAF-TB,
ministère
or do they have like
ou
specific services
comment en fait
that they are responsible of? So
cette intégration en fait des
how
services
do you really
elle peut être
ensure
faite
the
dans
integrations
d'autres ministères?
of
Je ne
TB
sais
in
pas
all
si
the
ça a
other
été fait dans ce
ministries?
sens.
So I don't know if you can have a contribution on this point.
Коллеги,
okay.
окей.
Can you?
Мелисана, вы хотите сейчас ответить на этот вопрос,
Do
или
you
я
want
бы
to answer this
предложила,
one,
чтобы мы
or I would
переходили к
suggest
следующему
that we
спикеру, а
can
вы,
move to the
возможно,
next
можете
speaker
ответить на этот
while
вопрос в
you
чате,
can
потому что у
post your
нас есть
response
еще
in
несколько
chat,
комментариев
because we have
от
some of the
участников в
comments
чате, и было бы
from
хорошо тоже
our participants
отреферовать
in chat, and it would be good if you could address
их
them
вопросы.
as well.
Видите, вы
You see,
возбудили
your presentation
аудиторию,
sparked our
Okay.
interest,
и
and
было бы хорошо, чтобы
it would
мы
be good
продолжили
I think,
общение в чате.
if you
yeah,
could continue just talking to them
I
over
think I
chat.
can respond on the chat. Okay, there's no problem. But about the last question, I think
Ну и
I
кроме того,
presented.
в конце встречи у нас еще будет интерактивная
Also, at the end
сессия,
of the
более
meeting, we will
расширенная,
have
где
a
мы
larger
вернемся к
interactive
этим вопросам,
session,
если
so we
будет
can
какие-то
revisit some of the
обсудить.
questions if there is a need. All right?
Okay.
Хорошо? Хорошо. Тогда, коллеги,
Very good.
еще раз
Thank you.
огромное вам спасибо.
Thank you once again to your colleagues.
Все ваши
And
комментарии
Melisana will address
блоке
all your
вопросов и
questions and
ответов
comments
непосредственно
in
в
chat.
сообщениях. Поэтому, если у вас есть еще какие-то
Therefore,
вопросы,
if you
пожалуйста,
have
не
any other
стесняйтесь,
questions or
пишите.
inputs, feel
И
free to post them.
я начинаю блок следующей презентации. У нас еще будет возможность, как сказала Александра,
the next block of presentations, because Alexander mentioned that we will have another Q&A at the end of the session. But for now, we're moving ahead, and now we'll have several views at Bangladesh experience in implementing MAF-TB action plan, steps 4 through 7. And we have with us representatives of 3 different sectors from one country. And we're very grateful to our distinguished speakers for their willingness to share their experience of MAF-TB implementation and expanding the engagement of key stakeholders to address the social determinants of TB. With that, I am glad to introduce the National TB Program Manager from the Ministry of Health and Family Welfare of Bangladesh, Dr. Zahangir Kabir. Dr. Zahangir, you have the floor.
Good morning and good evening. I am Dr. Mohammad Jahangir Kabir. I am the National Program Manager from Bangladesh, National Tuberculosis Control Program. Now I'm presenting the implementing MAF-TB action and expanding engagement to the stakeholders in Bangladesh. Can you hear me? Am I audible?
Да, мы вас слышим. Если можно, говорите следующий слайд, когда нужно переключать слайды.
Yes, please also let us know when you need us to switch the slide.
Please English. I can't understand your language. Please translate it in English.
We can hear you.
We can hear you well. We can hear you well,
you.
but please inform us when we need to switch the slide. So the next slide, say next slide. Thank you.
Okay. Okay. Next slide, please. Please next slide, please. Yeah. And now the estimation that the TB in Bangladesh in the 2023 in the global tuberculosis report in 2015 to 24, the incidence of the TB was 379,000, and that is the incidence is 221 per lakh population, and incidence of TB HIV, it is 740, that is 4.43 per lakh population, and incidence of TB with the antibiotic resistance, that is 5,000, that is 2.9%, and HIV negative, that is 26 per lakh population, and the mortality of the TB due to HIV positive is 170, that is 0.1 lakh per population. Next one, please. That was for which is the what's like the trends of TB incidence and mortality rate. That is, you can see in the 2010 that was just the graph is to upwards direction, and in 2020 the graph is slightly downwards due to the pandemic situation in that region, and after that in the 2020 that is some programmatic challenge. That's why the graph is downwards, and now in the 23 and 24 the graph upwards in positive direction. And the estimated number of deaths caused by TB in Bangladesh, you can see that in 2010 the graph is gradually downwards in direction. Next slide, please. Next slide, please. Yeah, the trends of TB incidence and notified cases, notification and treatment coverage. You can see in the 2025 to 2015, that is only 58% TB was notified, and coverage was only 58%. But in 2023, it is coverage rate is about 80%. I think our graph is gradually increasing towards the 100%. And estimated reported TB cases age groups in Bangladesh, you can see the male patients, the new case relapse and notified cases are higher than the female cases. Next, let's. It is the picture of the Bangladesh hosted the first, next slide, please. The picture, Bangladesh hosted the first global forum of advancing multisectoral and multi-stakeholder engagement and accountability to NTB in Bangladesh, June 2024, organized by the WHO, held in the Dhaka in Bangladesh. That's the picture of that, ceremony. Next slide, please. The multi-sectoral accountability framework for Bangladesh. You can see Bangladesh participated and was a signatory of the Moscow Declaration in November 2017. The political declaration, the UN General Assembly high-level meeting on the fight against TB. September 2018, the ministerial statement of commitment of the high-level meeting renewed in the 20 TB response in the Southeast Asia region, October 221, the Gandhinagar Declaration 223, and the political declaration of the United Nations high-level meeting TB September 2023. In this, Bangladesh is one of the participated and signatory of this committee. Next slide, please. From this committee, Bangladesh adopted some things. Bangladesh conducted a baseline assessment of the multisectoral engagement on TB in 2022, developed MAF-TB action plan in 2022 based on the assessment report, update the national strategic plan to end TB in 2023. Operational handbook of the MAF-TB was launched in 2024. That's the picture of the left side. And aim of the MAF-TB in Bangladesh is that to guide the strengthening of accountability by the national political and administrative leadership and multisectoral partners and stakeholders to achieve and assess the progress towards implementing political commitments and targets agreed upon. Next slide, please. Next, there are some commitments. The operationalized and empowered country initiative led by the highest possible political level, increase budgetary and human resource allocations, ensure the highest attainable standard of the rights based stigma-free, quality assured, people-centric preventive, diagnostic, treatment, rehabilitative, and palliative care, and mainstream social and financial protection along the TB care services. Next slide, please. There is a snapshot of the platform and strategic actions in Bangladesh. You can see we have the constitution, we have the Ministry of Health and Family Welfare. Under the Ministry of Health and Family Welfare, we have some regulatory bodies. That is the Bangladesh Medical and Dental Council, Bangladesh Nursing Council, State Medical Faculty, and there's implementing authorities like Director General of Health Service, Director General of Family Planning. Under the Director General of Health Service, there is some community clinics in the grassroots level, union and rural health centers, sub-district health complexes, district and general hospitals, medical colleges, all are under the Director General of Health Service. Similarly, some institutes or some health facilities under the Director General of Family Planning. In the others in the parliament, that the platform for the strategic action plan in Bangladesh, the parliament have some proposed multisectoral platforms like parliamentary TB caucus, TB task force. And other hand, other than health ministry, we have involved some important ministries for the TB for the action of the TB, like Ministry of Local Government and Rural Developments, Ministry of Home, Ministry of Social Welfare, Ministry of Defense, Ministry of Railways, Ministry of Industries. All are involved in the one platform for the strategies and action in the Bangladesh. Next slide, please. In MAF-TB, the Bangladesh has some commitments. We have some commitments in line with the global communities, like the Sustainable Development Goal for the 2003, adopted in the 2015, WHO NTB strategy adopted in the 2014, associated with the WHO resolutions, and the political declarations in the United Nations General Assembly high-level meeting in tuberculosis 2018. and some national commitments also. The 7th year financial year goals, strategies, targets in the health, nutrition, and population sectors. The 4th sector, population nutrition sector program 2017-2022, and 5th sector is preparing for the next years, and review and ongoing some investigative actions and ongoing and there's some monitoring and reporting systems also. Specific activities. Next slide, please. Next slide. There are some specific activities by the key ministries of the TB eliminations, like Ministry of Local Government and Rural Development and Cooperatives. It has the urban. This ministry have the urban coverage, own health infrastructure, service facilities, and dedicated HRs. That this strength we can collaborate with the diagnostic and treatment integration, HR capacity buildings, awareness, TB prevention, explore the funding opportunities, operating the TB service and health facilities, capacity building also. Ministry of Education, it has a dedicated health resources, large infrastructures, large geographical coverage, both community and urban level. This strength we can utilize in the introduce TB in the curriculum of the teachers and training, introduce TB in all curriculum, incorporate the TB basics of the stigma, develop age-specific IEC materials, awareness generation with the students and their parents, health camp on the TB screening at the educational institutes, and incorporate TB in the Little Doctor initiative. In our school health, there is a program, the Little Doctors program. The school students are organized the health camps in their campus. They give messages to their friends about nutrition, about hygiene. In this program, we can incorporate the TB program also. Next slide, please. The Ministry of Women and Children Affairs, it has some health resources, large infrastructures, large geographical coverage, both community urban level. These structures and these strengths also we can collaborate with the greater advocacy for female and child to incorporate the TB into their agenda. Funding for the nutritional support, social support for the female and child TB case detection, integrate the TB activities into the existing project, develop integrated IEC materials for the working women hostels, daycare centers, and the workplace, such as ready-made garments and others. Ministry of Planning, this ministry is industrialize the interministerial collaboration for the TB elimination and also allocate enhanced funding and resources in the national development planning process. Facilitate this resource strength, we can collaborate with the facilitate the high-level interministerial coordination, collaboration for TB elimination, enhance the cooperation with other department ministries, allocate funds for the TB in the relevant operational plans. Next slide, please. Next slide, please. There's similarly, we have the Ministry of Finance, Ministry of Home Affairs. They have some strengthened. This strength we can collaborate with the TB eliminations. Next slide, please. Next slide, please. Next slide. There is a Ministry of Defense. There is a with the Ministry of Defense, there is existing and MEU between the Director General of Health Service and the DGMS, and this ministry has a large health infrastructures. They have the skilled HR service providers, service available in the general populations and large populations of all cantonments and congregation settings. And the areas of collaborations, this strength and expand screening and diagnostic and treatment integrations ongoing. In the meantime, we have involved them in the TB elimination programs. Health services also in the Ministry of Defenses integrate TB in training curriculum and designing the response of the program. And another ministry, that the Ministry of Post, Telecommunications and Information Technology. This ministry has some strength like government commitment of the digital Bangladesh, immense scope for the access to the large proportion of the population for creating awareness, generating demand and community contact. This ministry, this strength, we can collaborate with the TV in communication strategy of the ministry, support the development of relevant program design, use the existing mass media channels like televisions, radio, mobile phones, apps, etc. for propagating the information on TV. Next slide, please. Then the other ministry like Ministry of Social Welfare. Slide change, please. Next slide. Some collaboration with the specific departments with the Ministry of Health and Family Welfare.
For the French part, can you go back, please?
We have the National Nutrition Service, non-communicable diseases, maternal, neonatal, child health, adolescent health. That's some departments of under the Ministry of Health. We are collaborating with them to eliminate TB. With the Health Education Bureau, with the National AIDS and STD Control Program, Health Engineering Department, Bangladesh Medical Research Council also. These all are the departments collaborate with the Ministry of Health and Welfare. Then we are for the elimination of the TB. Operationalize MAF-TB actions in Bangladesh, like estimated of high-level multisectoral coordination body for MAF-TB in Bangladesh, building the Bangladesh TB caucus, and involvement of the ministries other than health TB eliminations, involvement of relevant departments in the Ministry of Health and Family Welfare in TB elimination, and engaging the corporate sectors, principal business associations in Bangladesh for TB care and prevention, engaging private healthcare providers is covered under the PPM strategic plan in the country. Next slide, please. Next slide. Please, next slide, please. Yes. Activities for the operationalize of the MAF-TB, that is a multisectoral coordination and sensitization meeting at the central level is already happening. And multisectoral coordination and sensitizing meeting in the divisional level. Divisional level and multisectoral coordination and sensitization meeting in a district level also, regular coordination meeting with the local government department and organize the workshops, develop partnerships with the potential corporate sectors involving the large CSR programs, workshop for the stakeholder mapping, develop a health advocacy strategy and periodic follow-up in the NTB progress, and secure sustained financing for the TB health. Organize biannual TB caucus with the Joint Parliamentary Standing Committee for the Health Cabinet Division, including the Ministry of Planning and Finance. This is from the Bangladesh MAF-TB strategy. Please, next slide, please. Slide, please. Thank you. This is the logo of the MAF-TB Global Forum meeting was held in the Dhaka, where we have all of us celebrated that program that hit TB out of Bangladesh, and we are working together to hit TB out of Bangladesh. Thank you from Bangladesh. Over to you.
Thank you so much, Dr. Zahangir Kabir. It would be great if you can switch to the English language, because we as moderators, we are speaking Russian. So there is a English mode that is available for your understanding. And it would be great if you can change your settings to the English language. And I'm switching to Russian language so that we can continue.
Okay, thank you.
Огромное спасибо еще раз.
Thank you so much once again, Dr. Zahangir Kabir, for your presentation, for your great work, and for sharing the outcomes of your work to colleagues from different countries of the world. We have another representative of Bangladesh representing a ministry beyond health, which is very important. So please give some time to Melisan for her to answer the question. Thank you.
Коллеги,
Colleagues, please mute yourself. Colleagues, please mute yourself because we can hear you. Thank you so much. And please give Dr. Miller-san some time to answer, to respond to your comments and answers. And we are very interested to know the experience of the Ministry of Foreign Affairs in MAF-TB. So over to Sayed Jasmine Sultana Milka for sharing the Bangladesh experience, the experience of the Ministry of Foreign Affairs. And please, if you have any questions on the previous presentations, please post them in the chat. And now over to you, Ms. Milka.
Thank you very much. Thank you, moderator. Ladies and gentlemen, good morning, afternoon, and evening. This is Soeda Jasmine Sultana Milki, DG, Corona Cell, Ministry of Foreign Affairs, Bangladesh. I am honored to speak before you today about a critical public health issue that continues to challenge our nation and the globe in general, that is tuberculosis. Bangladesh is among the 30 high TB burden countries worldwide, but we have significantly reduced TB mortality and ensured a high treatment success rate, helping us move closer to our goal to ending TB by 2035. We have made TB service completely free of charge, ensuring access to quality medicine and diagnostic throughout the country. These services are integrated with general health services that reach even the most remote areas. Our treatment success rate has consistently remained above 95% since 2015. Additionally, TB mortality has significantly declined from 54 per 100,000 in 2006 to 25 per 100,000 in 2024. In Bangladesh, efforts to combat TB involve a range of interventions aimed at prevention, diagnosis, treatment, and support for affected individuals. Some key TB interventions are: number one, expansion of diagnostic services. Bangladesh has expanded access to TB diagnostic services, including Gene Expert, TrueNet, and Test X-rays. This has helped in early detection and prompt treatment initiation. Number two, integration with primary healthcare services. TB services are integrated with primary healthcare facilities to improve access and coverage, especially in rural and remote areas. This integration enables early case detection and improves treatment outcome. Collaboration with non-governmental organizations, that NGO. NGOs play a significant role in TB control efforts in Bangladesh by providing support services, advocacy, and community engagement activities. Number four, engagement of private sector providers. Collaboration with private healthcare providers is promoted to expand access to TB diagnosis and treatment services. Public-private partnerships aim to ensure quality care and adherence to national TB treatment guidelines. Number five, TB HIV collaborative activities. Given the high burden of TB, HIV co-infection, Bangladesh implements collaborative activities to provide integrated services for TB HIV diagnosis, treatment, and care. Number six, capacity building and training. To strengthen the healthcare system's capacity, healthcare workers, including doctors, nurses, and community health workers, receive training on TB management, diagnosis, and treatment. Number seven, surveillance. Routine data collection, case investigation, FOSI investigation and response, and data analysis to understand the disease situation for prompt decision-making are required interventions. Despite our progress, several challenges impede our fight against TB. These include ensuring timely and adequate supply of diagnostic, logistics, and drugs, addressing TB in urban areas and hard-to-reach populations, including prisons, improving child TB and extrapulmonary TB diagnosis at all levels of healthcare, engaging private sector in TB case notification and referral, transitioning human resources to the operational plan, bridging the funding gap. Currently at approximately funding gap is 40% of the national strategic plan requirements. To overcome these challenges, intensified efforts and increased diagnostic findings are essential. We need to prioritize investment in strengthening the health system and surveillance capacity. The government of Bangladesh's transition and sustainability plan for the integrated TB program is crucial. The donor finding remains necessary for TB control in our country. While we have made commendable progress in TB control, continuous effort and collaboration actions are vital to sustain and adherence these gains. Here, Ministry of Foreign Affairs tried to project national interest through the lens of diplomacy by utilizing multilateral, bilateral, trilateral, and regional platform. Also, we have supported the participation in framing national policies as well as in awareness building program. We gave our effort to get health-related agreement, treaty, and international commitment channeled through the Ministry of Foreign Affairs with the cooperation of global community. This year, United Nations has arranged antimicrobial resistance, where TB is the main focus. In conclusion, let us renew our commitment to ending TB, ensuring healthy lives and promoting well-being for all. Together, we can achieve a TB-free Bangladesh and world. Before give you a thank you, I have a request. I don't know whether it is the actual platform or not. If it is possible to include Ministry of Foreign Affairs in the national program for all the countries, that would be better, because all the Ministry of Foreign Affairs of all the countries has some jurisdiction who taking care the countries national as well as countries national who are working abroad, and as well as the diplomats and diplomatic diaspora who are working in the host country. So these are the community which can be taken care by the Ministry of Foreign Affairs directly. So thank you very much.
Огромное спасибо, госпожа Милки, за ваш вклад в
Thank
дело
you
борьбы
very
с
much, Ms.
туберкулезом
Milky, for
и
your
уникальный опыт, который
contribution
делитесь с
to
нашими
TB
участниками.
control
И
and for
особое
sharing
спасибо
your
за
unique
ваш
experience with
запрос,
our
который вы сейчас
participants. And
озвучили в
thank you
конце.
for this request.
Среди
By the
наших
way,
участников
because
много
amongst our
представителей
participants, we have a
национальных
lot of
туберкулезных программ
representatives
разных стран.
from national
И я
TB
верю, что
programs,
ваш запрос
country
будет
TB
услышан, и они
programs, and
рассмотрят
I do
возможность
hope that
включения
they have
других
heard you
министерств, а также
and they will
Министерства иностранных
consider
дел в
integrating
борьбу с
Ministry of
туберкулезом.
Foreign
Спасибо вам
Affairs along
большое.
with other ministries
И
in national
продолжение
TB control
обзора
programs.
многосекторального
Thank you for this
ответа на
request and
туберкулез в Бангладеш
proposal.
я хочу
And
представить вам
again,
нашего
now
следующего
I
спикера.
want to introduce
Это
our next
представитель
speaker who
неправительственной организации
represents
БРАК,
a non-governmental
доктора
organization
Farhane
called
Nishat
BRAC
Saheri,
from
старший
Bangladesh,
менеджер по
Dr. Farhane
диагностике
Nishat
вопросов
Saheri, Chief
отдела
Manager,
инфекционных заболеваний
the
программы
Chief Director on
Commission
Technical
БРАК
Issues
Бангладеш.
from
Уважаемая
BRAC,
доктор Сахери,
Bangladesh.
вам слово, пожалуйста.
Dr. Saheri, over to you, please.
Thank you. Thank you for the opportunity.
Спасибо большое, спасибо за предоставленную возможность выступить и всем добрый день.
Good afternoon, everyone. We have already heard a brief overview from the previous speakers on the experience of Bangladesh for implementing the multisectoral accountability framework in Bangladesh. Now, I'm going to provide a very short demonstration of BRAC's approach on implementing this MAF in Bangladesh. BRAC is an international developmental organization founded in Bangladesh in 1972. For the 5 decades, BRAC has been working on empowering people and reducing poverty, with a special attention to the poorest and most disadvantaged groups of people. Currently, BRAC is working in 10 countries. Since its inception, BRAC has an aim to support government's developmental journey to achieve the SDGs. So Our strategic direction is aligned with the national plans and policies. And as the global and national contexts have evolved, BRAC has continually refined its strategies to remain impactful and to be aligned with the SDG plan. And BRAC's approaches includes the cluster-based programs and the system strengthening, new and innovative models developing, and also building partnership with government and other stakeholders for effective implementation. BRAC has a commitment to contribute in the SDG plan with a focus on poverty alleviation and food security, employment, quality healthcare provision, education, climate resilience, as well as gender equality, comprehensive inclusiveness, as well as humanitarian responses. Next slide, please. Our approach is community-based healthcare model to reach the most underserved and disadvantaged people. We have a wide network of community healthcare providers. We have the emphasis on strengthening this community healthcare workforce for providing the quality healthcare in a people-centered approach. And these community health workers actually acts as a bridge between the healthcare system and the communities. And BRAC has a long-standing partnership with government and other stakeholders. We often pilot programs to generate evidence, which inspires to policy changes as well as helps to achieve the national goals. We also invest our resources to reach these services at the last mile of the communities so that no one leaves behind. For tracking our contribution to the SDG, we already have published a progress review report, and which covers the impacts on 15 sustainable development goals, right? And you can get this report in our website for getting detailed information about this. Next slide, please. For healthcare service provision, BRAC has a strong collaboration with the Ministry of Health and Family Welfare. And we work for the strengthening of the health service delivery system as well as the healthcare system. We provide some primary healthcare services both in urban and rural settings. We also provide services for maternal and child health, and also we have services in an integrated approach for eye care and non-communicable diseases like diabetes and hypertension. We do screening and ensure the treatment of these patients. We also have collaboration with National Tuberculosis Control Program and also with National Malaria Elimination Program to combat the communicable diseases like TB, malaria, and HIV. We have some services for strengthening the healthcare system. We provide services for to the at national level, district level, sub-district, and at community level also. And we provide some services like supply chain management and also some services for human resources and also logistics supports to function for the functionality of these public health services. We also provide some services for the support for the infrastructure of the public health facilities. We also provide services for addressing the needs of climate migrants, also the health needs of the climate migrants. And we, during the COVID-19 period, we had a strong collaboration with government to provide the treatment, to provide the prevention, diagnosis, and treatment for COVID-19. And I can mention about recent emergency activities, like at the end of the August, Bangladesh has been terribly affected due to flash flood in the eastern region. Some of the districts were terribly affected. And immediately on that time, we provided emergency health services along with provision of essential medicines in this impacted districts. And we deployed medical team, which consists of medical doctors and paramedics. And in 1 month, we provided treatment to more than 100,000 people in these affected districts. Still, we are continuing our services for the recovery phase of, in this flood affected area. And we did this collaboration with this services provision in the collaboration with the government and other NGOs, and also armies, students, and other volunteers. Next slide, please. For addressing the social determinants of health, we have the engagement beyond the health ministries. We have collaboration with Ministry of Finance, Agriculture, Fisheries and Livestock, Ministry of Environment, Forest and Climate Change, and disaster management, also LGRDs. All of this collaboration helps to provide services for poverty reduction, for food security, for humanitarian response. And for the TB services, we have collaboration with the Ministry of Home Affairs and other sectors like industries, railways, shipping. And through this collaboration, we provide TB services in prisons, in railway hospitals, in port health facilities, as well as in workplaces. Next slide, please. We also have the collaboration with the non-government sectors like business associations of garments and factories, and the owners of high-risk settings like tea garden, brick fields, transport sectors. And we have this collaboration helps us to access in the workplaces to provide the TV services. And as in addition to that, we engage the social leaders, ethnic minorities, and the affected population so that it can create a community-based support system among the communities. We also engage the educational institutions to raise the awareness among the children and the teachers, and it also helps to spread the awareness among the community, and it helps to diagnose the child TB very early. And we also have collaboration with private healthcare providers for broader the service delivery, as well, and also with the academia for research opportunities and for knowledge sharing for TB treatment and prevention. Next slide, please. This slide is featuring some pictures of the engagement of the stakeholders for TB services. In the second picture, you can see there is a session conducted in private specialized hospitals to engage the private sectors, especially the doctors in the private sectors, so that it can increase the private sector engagement, as well as it can help to increase the case notification from the private sectors. And also in the workplaces, we conducted some sessions, you can see in the pictures. So you know that the workplaces is a very close setting, so people work in a very close setting so that it can facilitate the spread of TB very easily. So we do the session in engaging the employers as well as the employees. It helps to make them understand the the importance of the early diagnosis and importance of the complete treatment of TB, as well as it helps to reduce the stigma and also make the policies, workplace policies, so appropriate for the employees, so that it can help to promote the health-seeking behaviors among the employees without the fear of losing the job. So we also, you can see in the third picture, there is a mobile diagnostic van. So we take this mobile diagnostic van in the workplaces so that the people with the symptoms of TB in the workplaces, they can come and do the screening and diagnostic testing. And after the diagnosis and if someone is diagnosed as TB patient, we link them to the healthcare facility so that we ensure their initiation of the treatment, as well as we ensure the dot provision of these patients with with continuous supervision and monitoring. And these kinds of interventions actually not only contribute for TB control efforts, but also helps to maintain a safe and healthy environment in the workplaces. And thank you. That's all from my side. And thank you for your attention. And if you have any question, I will provide my email address in the chat box, so you can ask me. Thank you.
Уважаемая доктор Сихели, большое спасибо вам и спикерам из
Dr.
государственных
Sihele, thank you so much. Thanks to you and to other speakers from the governmental bodies of Bangladesh for sharing the example of Bangladesh that could really be a role model for many other countries. And just reminding all the participants that you can actually post your questions in the chat. And after the final presentation, we'll have an interactive session for questions and answers. And now the final presentation for today about the algorithm for MAF-TB in Ukraine, including all the 10 steps recommended by WHO. And you know that in Ukraine, Ukraine has had war for 2 years already, and every night peaceful settlements are being shelled, including the capital. However, the national TB program still ensures continuous prevention and treatment and care for TB to all who need it, and also ensures multisectoral coordination with different ministries and departments beyond health. And now it's my pleasure to give the floor to the head for TB control department of the Ministry of Health of Ukraine, Ms. Yana Tsikleeva, for sharing the experience of Ukraine.
Dear colleagues, I'm honored to present Ukraine's national TB program. Next slide, please. As a UN member state, Ukraine is dedicated to fulfilling the commitments of the political declaration on tuberculosis. Despite facing over 2 years of full-scale war by Russians against Ukraine, Ukraine remains steadfast in advancing the global TB goals set at the UN high-level meeting. Please, next slide. In Ukraine, the need for a multisectoral approach in combating tuberculosis is established at the level of the updated law on TB control. This law also defines the concept of a multisectoral approach, highlighting the importance of uniting efforts across various sectors for effective disease control. Next slide, please. Following the WHO operational guidelines on MAF-TB implementation, Ukraine has identified 10 key steps in the MAF-TB algorithm to accelerate progresses on TB elimination, adopted to our national context. This comprehensive MAF-TB algorithm supports cross-sectoral collaboration and accountability, formalizes and structurized roles, stages, and actions to drive cross-sectoral progress to end TB in Ukraine. Through regular high-level reviews, TB is maintained as a national priority, highlighting our unwavering commitment to comprehensive action and TB elimination. Next slide, please, with step 1 of the algorithm. In Ukraine, we have fostered a supportive environment for the initiation of the MAF-TB at the national level. This is facilitated through consultative platforms such as National Council on TB HIV Response, or in other words, CCM, the Stop TB Ukraine Partnership, and the Parliamentary Platform for TB. Civil society plays a vital role in Ukraine's fight against tuberculosis, contributing significantly to advocacy, awareness, and community-based support. Their involvement enhances our collective ability to implement MAF-TB effectively, making a mindful impact on TB control and elimination efforts across the country. Next slide, please, with step 2 of the algorithm. In 2021, Ukraine conducted its first baseline assessment in accordance with the 3 annexes of the MAF-TB checklist. This assessment was a collaborative effort engaging the Ministry of Health alongside other key stakeholders, including civil society and affected communities. Their findings were presented at a meeting of the CCM, underscoring our commitment to transparency and collaborating. Ukraine was also one of the pilot countries globally to implement an assessment based on Annex 4, especially evaluating parliamentary engagement in the fight against tuberculosis. In 2023, we repeated this baseline assessment, taking account the unique and challenging factors introduced by the ongoing full-scale war. This reassessment has enable us to adopt our strategies in line with current realities and strengthen our response to TB under these difficult circumstances. Next slide, please, with step 3 of the algorithm. The coordination of the multisectoral response to TB is overseen by the National Council on TB and HIV, or CCM, and advisory body to the government as a consultative and advisory entity. The Council plays a crucial role in uniting stakeholders across sectors to strengthen and streamline efforts to combat tuberculosis spray nationwide. Next slide, please, with step 4 of the algorithm. Now we look at a schematic representation of multisectoral interaction in the field of combating tuberculosis. It is a joint effort of interested parties, which is possible only under the condition of concerted activity. As you may see on the slide, the CCM is an important link in the coordination of all processes. Please, next slide with step 5 of the algorithm. The implementation plan for MAF-TB in Ukraine is considered to be the operational plans for the implementation of the state strategy in the field of HIV, TB, and viral hepatitis response through 2030, as well as the state strategy for the development of the TB healthcare system for the population. Next slide, please, with step 6 of the algorithm. Each year, a national advocacy plan is developed, encompassing of activity of all partners and supported by regular reporting. Please, next slide. The sources of funding for multisectoral response measures at the national level are clearly defined and allocated within the national strategic plan to combat tuberculosis. These sources might include internal funding from the health sector and other sectors, as well as international resources to support essential measures such as universal access to TB diagnostic, prevention, treatment, and care. During Russia's full-scale war against Ukraine, no additional mobilization of state resources for MAF-TB implementation is anticipated. And next slide, please, with step 7 of the algorithm. Social determinants of TB risk factors can and should be addressed through multisectoral efforts, enable us to eliminate TB effectively. These factors are comprehensively considered in the implementation of the National TB Control Program. In particular, the tuberculosis medical care standards identified a wide range of target groups based on health-related risk factors. By focusing on these determinants, we can enhance our approach to TB prevention and treatment, ensuring that all aspects of health as well-being are taken into account. Next slide, please, with step 8 of the algorithm. The law Ukraine on combating tuberculosis in Ukraine ensures free and equitable access to quality medical services as necessary medications for individuals affected by TB. This includes early diagnostics and prevention services, as well as social services aimed at supporting those affected by the disease. Next slide, please, with step 9 of the algorithm. To measure the progress of national multisectoral TB control efforts, this following has been implemented regular counting and reporting on TB, including monitoring of morbidity and mortality rates, annual public analytic statistic reports, monitoring of indicators related to social and economic factors, as well as health risk factors associated with tuberculosis, conducted national surveys and other research, annual public national reports on tuberculosis, annual report to WHO, and reports from civil society and non-government organization. All reports are publicly accessible in the Ministry of Health and Center Public Health websites. Additionally, as part of regular monitoring and reporting, central executive authorities submit annual updates to the CCM on the implementation of operational plans for the two national state strategies. These strategies are regulated as MAF-TB plans and form the foundation for MAF-TB implementation in Ukraine. Next slide, please, with step 10 of the algorithm. In Ukraine, various mechanisms exist for high-level reviews of multisectoral TB actions, including parliamentary and committee hearing. The country also periodically conducts WHO comprehensive review on the national TB program, most recently conducted in 2023. The regularly assess multisectoral TB efforts, fulfilling political commitment progress, achieving national TB goals and MAF-TB implementation. A high-level review is planned every 3 years before developing operation plans or NSP for state strategies. This multisectoral review will involve relevant bodies and sectors presenting reports and analyzing recommendations based on the preceding baseline situational assessment. Adopted at the CCM meeting in March, the algorithm for MAF-TB implementation aims to strengthen collaboration across sectors, laying a foundation for Ukraine enhanced TB response and progress toward UN TB declaration goals. We thank our partners who have actively contributed to implementing the algorithm: the Ministry of Health, the Public Health Center, CCM, the WHO Regional Office for Europe, TB Coalition, Stop TB Partnership, TB People, Alliance for Public Health, and other partners. Thank you very much for your attention.
Уважаемая доктор Яна, большое спасибо за вашу
Dr.
презентацию
Yana,
и
thank you very
главное
much
за
for
всю
your
ту работу,
presentation
которую вы
and also for
проводите
all the work
ежедневно
that you're
для
doing on a daily
сдерживания
basis
туберкулеза и
to
укрепления
contain
многосекторального
TB
ответа на
and
это
to
заболевание.
strengthen
Принимая
multisectoral
участие в
response
разработке
to this disease.
презентованного алгоритма, команда Европейской коалиции
The
убеждена, что он
European
станет
TB
надежной
Coalition, being a
информационной
party to
основой
this
для
algorithm,
реализации
is
всех
confident that it will
10
become
шагов и
a
внедрения в стране
sustainable
МАФа.
foundation for
И еще раз
introducing all
благодарим
10
вас и
steps
всех
of
спикеров,
MAF.
которые сегодня
And
нашли
we
возможность
thank you and all
поделиться
other
своим
speakers who
практическим
found their
опытом.
time to share their
У
practical
нас
experiences
перед
today.
сессией вопросов и ответов мы бы
Before the
хотели сделать
Q&A session,
небольшой
we
опрос,
would want to have
где бы мы хотели
a quick
узнать ваш опыт по
survey
внедрению
to also
МАФа.
learn about your
Поэтому я
experience
прошу своих
of
коллег сейчас вывести на
introducing
экран
MAF.
опросы, и после чего
So
мы
I
начнем
suggest my
сессию
colleagues pull up the
вопросов и
survey.
ответов.
After
Приготовьтесь,
that, we will have
пожалуйста.
the Q&A session. So please get
Уважаемые
ready.
коллеги, большая просьба
Dear
дать
colleagues,
один вариант
please
ответа на
choose
первые
just
3
one
вопроса в вопросе,
option
который вы
for
видите
the first
сейчас на
3
экране,
questions.
и на последний 4-й вопрос
And the
просим вас
final, the fourth
ответить
question,
все
please
релевантные варианты.
tick
Если вдруг
all
вам на
boxes that
экране
apply.
компьютера не до конца
If for
виден
some
перевод на
reason
ваш язык,
you
просто
don't see the
окошко
interpretation into your
с
language or that the
опросом необходимо
translation of the
растянуть,
question,
увеличить,
you
и
just need
тогда
to
вы
expand
прочитаете. На телефоне такого
do
возникать.
with the questions. You should not be running into the same issue on your
Чтобы
mobile
не
phones.
задерживаться сильно, мы подождем
And without
буквально
further ado,
20 секунд.
I will give you
И
just some
те,
20
кто
seconds,
хочет
and
ответить на вопрос, пожалуйста.
so
Нам
those
будет
who need this
действительно
time
интересно
to
узнать
answer this
о том, как
questionnaire, please do that,
реализовываются вот эти
because it would be
несколько
important for us
шагов
to know
ММПТБ, которым
how
посвящена
these
сегодняшняя
steps
встреча
of
по всему
MAF-TB are being
миру.
implemented across the world.
Мы видим, что участники активно
We
отвечают.
see that
Спасибо
the
вам за то,
participants
что вы
are very actively
вовлекаетесь.
responding to our questionnaire. Thank you for your engagement.
Мы видим, что уже многие отвечают, конечно.
We see
Но
many
есть также
people answering
участники,
yes, of
спасибо
course,
вам
but we
за
also have other
открытость, которые
participants
отвечают,
who
что
openly, and we thank you
никогда
for that,
раньше.
saying that never
То есть это
before.
говорит о том, что, в принципе, тема, которая сегодня поднята,
That means
и
that
она
the issue
является
that we
важной,
raised
потому что
today
еще не все
is an
знают о
important one
мультисекторальном
because
сотрудничестве,
not many
и мы
know
рады, что эта
about
тема
the
открыла какие-то
multisectoral
новые
cooperation,
вехи
and we're
и
happy
новые
that
направления для
this
вас,
issue opened up
для
some new
реализации в
milestones
вашей
and
стране.
targets for you to go further in implementing these in your respective countries. I think I'll give you a few more seconds, and after that, we will stop with the questionnaire and start with the interactive Q&A. Let me just respond or really comment on what the questionnaire yielded. The question is whether you heard about the MAF-TB. More than 90% responded that yes, they did, and still 5% said that they did not hear about that, or rather heard about that, but were not exactly sure what that meant.
I'm not able to see the questionnaire. Would you please how to get that? Is it
Neither can
required
I
for
see the
everyone to?
questionnaire. You're right, Zaida. I can also not see the questionnaire, and when I saw it, it was in another language, and I couldn't convert my language to English. The options weren't coming.
Yes, but it is not
Здесь не
here
будет
in the
варианта
screen.
переключения на языки. Этот опрос сделан одновременно на трех.
This questionnaire was in 3 languages. Every question was in 3 languages at the same time.
В том языке, в том переводе, который у нас
So
есть
basically,
сегодня
it was
на
one
мероприятии. То есть вам не
one
нужно
window
было его
with
закрывать.
all languages. You shouldn't have closed the
Подумали,
window when you
наверное,
saw
что
it.
на том
So you
языке
probably
нет и
thought that it
закрыли.
was not in your language and
Олеся, это
closed the
как-то
window.
можно вернуть
Let's can we
или
somehow pull it
уже не
back up,
получится?
or it's gone already?
Ну, давайте для того, чтобы
I'm
мы...
afraid, I'm afraid if I go back, it will just erase all the answers we have. And we have now like 50% of
К сожалению.
answers. Maybe you just
Давайте мы попробуем
minimize
чуть
the...
позже в чат скинуть
I
ссылку
will
на
probably post a
этот
link
опрос,
to
и вы
this
сможете
questionnaire
ответить на
in
его
our
ответ.
chat, and you
Сейчас,
can just
возвращаясь к
separately take
результатам,
it.
я хочу сказать, что более 60 человек
Now
подтвердило,
going
что в их
back
стране
to the
существует
findings, more than
национальный
60%
многосекторальный
confirmed
механизм
that
координации
they
и
have a
надзора. О том, что такого
multi-sectoral
механизма нет, указали
framework in their
27%,
country. 27% that
принявших
they
участие
said
в
that there's
опросе,
no such
и
mechanism in
точно
their
не
countries,
уверены 14%.
and 14%
На
are not
вопрос,
sure.
разработан ли план реализации МАФа,
As to the question
55%
whether the
людей
implementation plan
ответило
was
утвердительно,
developed, 50%
27% сказало, что нет
said
такого плана,
yes, 27 said that they don't have it,
19% точно не
19%
уверены.
said that
И
they're not yet
особенно
sure.
для нас был интересен последний
And
вопрос,
one more
это с
thing,
какими секторами
the question
существует в вашей
about
стране взаимодействие в
which
контексте
sectors
борьбы
you
с
have
туберкулезом.
cooperation
И мы
under
видим, что
TB
сектор социальной
response, and we see
защиты
that social welfare
набирает больше 60%.
is
Естественно, это
in the
для
lead,
нашей
more than
темы
60%, which
вполне
is only
логично.
natural
Около
for this
50%
issue.
образования,
Some
в районе
50% also
40-50%
mention education,
сфера труда
some
и
40% mention
юстиция.
labor,
Остальные
and justice
сектора
sector.
где-то порядка
Other
20%.
sectors
Кроме того,
yield
сотрудничество
some
с
20%
парламентариями
each.
указали больше
Also,
40%.
more than 40%
И
mentioned cooperation with the
43% указали
parliamentarians,
сотрудничество с
and
местными органами
43%
власти.
mentioned
А
cooperating with
также
local authorities.
65% сотрудничают с гражданским обществом
And
и с частными
65%
организациями,
work
сотрудничают
with the civil
40%
society, and 40% work with
стран
private
тех людей, которые
businesses
ответили на опрос. Это такое
in those
краткое
countries
его содержание.
that responded
Думаю,
to
что
this
сможем поделиться
questionnaire.
более
I
детальными
think we'll
результатами с
aggregate and
материалами
analyze
нашей
the
встречи.
findings
А
and share
теперь
it
я
with
прошу
you
своих коллег
along with the
закрывать опрос.
materials
И
from this meeting.
еще раз
I would ask
благодарю
my
всех
questions now
спикеров
to
нашей
close this
сегодняшней
questionnaire,
встречи за
and
прекрасные
I thank again
презентации, а
all the speakers
участников
for the outstanding
приглашаю
presentations,
к
and I invite all the
открытой
participants
дискуссии. Пожалуйста,
to
поднимайте руку,
indeed
задавайте вопросы, пишите в чате.
participate in
У
the
нас еще
interactive
есть
discussion.
время
Please
для
post
обсуждения.
those
Будем рады
questions or
вашей
inputs
активности.
in chat or
Спасибо.
raise your hands. We'll be happy to have an
Да,
interactive session
дорогие
with you for the next
коллеги,
10
у кого
minutes.
есть вопросы, у вас есть
Yes,
сейчас уникальная
thank you.
возможность задать свои
You
вопросы
now have a
представителю
unique opportunity
NTP
to
разных
ask
стран,
your questions
представителю
from
Министерства иностранных
NTPs of different
дел,
countries,
представителям
people from
гражданского
MFAs,
общества,
people from
поэтому
the
не
civil
теряйте эту
society.
возможность, пожалуйста,
Therefore,
задавайте свои
make
вопросы.
use of this opportunity, don't
Я
neglect it.
смотрю, что
I see that Dr. Melissa has already addressed almost all the questions that were posted in chat to her, but we have a number of other questions that colleagues were raising. Is there anyone who would like to speak up and ask a question? Please raise your hand. We will be happy to take those from you.
Бертран, вы хотите озвучить свой
Bertrand, do you want to
вопрос?
ask a question?
Бертран, вы хотите озвучить свой вопрос?
Bertrand, are you trying to ask a question?
Yes, I have a question. Yes.
Пожалуйста.
So congratulations for Ukraine. You guys present a very nice presentation and very high-level experiences around implementation of MAF-TB. MAF-TB was also implemented in West and Central Africa by draft TB in 12. And then my key question in terms of
Bertrand, unfortunately, we lost the sound. Can you please repeat your question? Or just write it in the chat if it's possible for you, because we lost you. While we are trying to return Bertrand, are there any questions to our speakers, participants?
Yes, I do have a question. I did post it, but I think it got missed. Can I ask?
Yes, please. And I believe Dr. Melissa answered your question if it relates to but yes, please.
Because I can't find the thread. I'm trying to look for it. So anyone else from any of the countries? So I'm Dr. Bushra Asif Ali Khan, and I'm a senior provincial program officer from Common Management Unit, which is our national TB control program. So thank you for all this massive information and learning from all the countries. I have a question that when you talk about since it's a multisectoral approach, so when you talk about involving all these sectors, what are the efforts that are made towards engaging them? Okay, fine. Like last time, Hannah told us that it varies from country to country, and depends on what sectors you want to work with or involve them other than the health sector. But then what efforts or what is the approach? Do you share write-ups? Do you have any sort of consultative meeting before engaging them or taking them on board? Or what is the approach, if you may? And then also when we talk about the provincial levels, and in any case in the ministries, till what level do you involve all these sectors and the provinces? Only the government or the private sector as well? And how do you go about it? Thank you.
It would be great if it can be addressed not only to Brazil, but if all three countries can answer this question. Thank you so much.
Sure, that would be more than that would be great. I think it would be even better. Thank you.
Thank you. So I'm asking all three countries to appoint NTP managers or other. It would be great if you can add, if you capture.
Yulia, there is also one question in the chat. How can a country initiate MAF-TB and who can do that? And it would be great if these two questions will be answered by NTPs of all presented countries.
Okay, so would Brazil like to answer first?
Yes, sure. Bushra? The question of Bushra? Yes?
Yes, Bushra, yes.
Okay, thank you. I think that engaging ministries beyond the health sector for effective tuberculosis control requires strategic approaches that foster collaboration, align interests, and secure funding. Here's how Brazil navigate these challenges. It's a challenge, but for the Interministerial Committee, we established the inclusion of representatives from various ministries, and we bring together different sectors, ensuring that TB is seen as a multisectoral issue. And we emphasize the alignment of TB controls goals with broader national objectives, such as poverty reduction, or, for example, the sustainable development, can foster a sense of shared responsibility among different ministries, especially the Ministry of the Human Rights and the Ministry of the Social Development for the issues about the social protection. And engage, for example, the Ministry of Finance to incorporate TB control into budget planning is also vital. I think that Brazil has successfully advocated for the inclusion of TB-related initiatives in the budgets of various ministries, like I said before, ensuring that funding is allocated appropriately. And I think about your question is about the public-private partnerships, right? And in Brazil, we encourage in partnerships with the private sector can enhance funding opportunity for no health initiatives, for example, relate to the TB control, like the program called PROAGE. This program works like the Hospital of Excellence receive tax exemptions, which are converted into investment for the SUS, for our unified health system. And in return, these institutions, these hospitals, conduct research and develop strategies to benefit the public health system, specifically the actions related to tuberculosis. For example, the pharmaceutical industry, the type of institution produce a drug or a vaccine, for example, and while gradually transferring the technology to the public sector. So I think during this transfer, the private company maintains a guarantee marketing, selling its project to our governmental in Brazil for a period of 5 to 10 years, for example, benefit both parties, the public-private partnerships.
Mm-hmm. Yes, thank you so much. And it would be great if you can address also the question that was announced by Sayohat regarding the initiation of MAF-TB. How it is possible, from your experience, to initiate MAF-TB in the country?
Hi, this is from Bangladesh. Dr. Rupali, may we respond our experience?
Yes, please.
Yes, thank you. In Bangladesh, what we did after introduction and launching of the MAF-TB by WHO, then we started dialogue at the country level to make greater awareness regarding the MAF-TB concept and its relevance with the TB. And we started the roundtable discussion and sensitization of the media, journalists, civil society by roundtable discussion. At the same time, we targeted our key stakeholders and policymakers. Then our step was that to translate some policy commitment, country commitment, global commitment, like UN high-level meeting, to make it instrumental. We that kind of policy brief, then we engage our policymaker that why the engagement of the multisectoral is needed beyond the health, and this is the country commitment. In such way, we tried to secure commitment and engagement of our policymaker and ministries beyond the health sector. And after this, what we did, we integrated this in our national strategic plan that MAF-TB need to be implemented, and we identified our activities and different stakeholders, roles and responsibility, who can do what. including the development partner, implementing partner. After then, we did the situation assessment, baseline assessment of the multisectoral accountability framework in Bangladesh. After having the baseline assessment, then we prepared the SOP, Strategic Operational Plan, and we prioritized our ministry beyond the health sector. Then at this stage, what we are now, our next step to identify the roles and responsibilities of the different ministries. And meanwhile, we already having some targeted intervention, like, for the prison, we are targeting the home ministry. For the employment, garments and workplace, we are engaging the employment. At the same time, we have planned to review the individual sector, some kind of law and policy, what is relevance with a TB patient care management and their rehabilitation. So in such a way, our next step to go beyond and further defining the roles and responsibility of our different ministries at the country level. So as of this is the update from Bangladesh and the way we have initiated and our facilitation process. Thank you.
Thank you so much. Я бы хотела сейчас пригласить к ответу
Thank you. And now I would like to ask Dr. Yana Terleva to share the experience of Ukraine. Yana, are you here? Can you please jump in? Thank you very much, Yulia. And I think that Ukrainian experience shows that involvement of different stakeholders, ministries, and departments needs to be organized in a systemic way so that every ministry, every stakeholder will understand the expectations from them. Because when we carried out the baseline assessment, we discovered that the major barrier is that the ministries and departments beyond health fail to understand their roles and responsibilities. That's why we need to strengthen advocacy and awareness raising with all the ministries all together and on a bilateral way with every single ministry or department. As I mentioned in my presentation, in Ukraine we have the National Council on TB and HIV that includes main ministries and departments. This is a high-level body, and involvement of high-level representatives in the National Council is a good way to overcome the barriers in TB response. And our next step was the adoption of an operational plan that became a part of the governmental strategy approved by the Cabinet of Ministers. And this operational plan includes specific activities, specific actions by different ministries and agencies. Thereby, this plan actually incorporates the obligations and commitments of different ministries so that all the ministries would know what they have to do and what budget they have to allocate for these actions. And this actually ensures a systemic approach to incorporating ministries and agencies. Thank you, Yana. And maybe you could share a recommendation as to how to launch MAF-TB in the country that does not have MAF yet. What should be the initial step? Thank you, Yulia. I think the first step is to have good partnership and good discussion between the partners. Initially, we started by involving the Ministry of Health, the National TB Program, international partners, and civil society. We brought all these together to discuss actually what to start with. And that became a basis for our next activity. So that was actually the national policy dialogue. that then triggered very good initiatives. So sometimes, you know, in some countries, you need to create something from a scratch, and in other cases, you need just to strengthen something that already exists, adding some maybe tools for decision making. So the path that Ukraine took was as follows. We saw that we had a national council on TB and HIV that for years had the experience of cooperating with different other agencies and ministries for TB response. So we decided that that was a good platform that we just had to develop on. And this is definitely a body we thought that could recommend policies. And so I think that you need to decide who is going to be the body coordinating MAF in your country. And so this first step is most difficult usually, and then all the other steps, next steps are easier. Thank you very much. Very good experience of Ukraine. Thank you for sharing. And I hope that the participants would try and incorporate your recommendations in their context. Initially, I saw that people, some people raised hands, but I think all the speakers have responded so well to the questions that now I no longer see any hands raised. Unfortunately, we don't have a lot of time left, but we have about 10 minutes for discussions. Over to Monica Diaz from WHO Global for a brief comment. Please, Monica.
Thanks so much, Julia, and many thanks to the excellent speakers from Ukraine, from Bangladesh, from Brazil, and also our regional office in Europe, and of course, TBEC for excellent moderation. Again, it's been very impressive to see the number of participants, the number of questions on these important steps on MAF-TB. My colleague Wongi has posted again for your information the adaptation guide that we have outlining clear steps. And Bushra and Paul, great questions that you've posted already. Bushra, you asked about write-ups. So I'd like to draw your attention to the best practices document. There have been several write-ups included, and we will be producing a new set of write-ups from countries. We are collating case studies. So more best practices will be published from across countries. And it's, as Yana very nicely mentioned in response to Paul, indeed, it is every country has their own way of collaboration and initiating MAF-TB. It's really important, but bringing everyone together and initiating a dialogue as early as possible in the planning stage itself. This is going to be important to really kick off MAF-TB in the country. So thanks for the opportunity, Yulia. Back to you.
Спасибо большое, Моника. Я думаю, что мы можем взять
Thank
последний
you
вопрос.
so much, Monica. And we can take one more question for today. I could see Shikona Kalibongo raising her hand. Please, over to you, Shikona. Sikona Kalivoglu.
The floor is yours. I see your hand. Я не уверена, что
I'm not sure if our colleague can hear us. Sikona, can you hear us? You can unmute yourself.
Возможно, Sikona, please. The floor is yours. Возможно...
Allô, vous me recevez? Allô?
Okay.
Can you hear me?
Yes, we can hear you.
Oui, on peut vous entendre.
Merci beaucoup. Moi, c'est Sekuna Kalivogui de la République de
I am Sekuna Kalivuki from Guinea. Very sorry I came late. I was organizing a training for paramedic. So for the implementations of MAF-TB, we've started in Guinea 2 weeks ago. So I would like to know if you have any recommendations of methodology that the different countries followed. We started first having meeting with WHO, CSOs, and the last meeting we had, we were wondering if there is a need to conduct an evaluation or if we should open the meetings to all other sectors of the Ministry of Health. So after this step, I know that the other step will be easy. So the countries that are here, if you can really recommend us, think the first step to take, that would be great.
Thank you so much, Sikona. I think Monica could take the floor to just like share her opinion about what you have already done and what could be your next steps. And maybe countries could share after Monica as well. Yana touched on this issue already, and I would welcome Brazil and Bangladesh also jump in and respond. Monica, over to you first.
Thanks, Julia. Sekuna, very good question. You joined late, but this is actually the second in a series of interregional meetings. The first meeting, and maybe Julia, I think there's a recording or a link that can be shared that really talks about the initial steps of MAF-TB, where we did have in-depth discussion on this. And what we recommend is indeed to initiate dialogue as soon as possible, to use heavily the process, for instance, like national program reviews or national strategic planning, to already bring key partners around the table. It would be good to do, one of the initial steps is a baseline assessment. This assessment, and this is what we discussed in the first meeting, this assessment can be built into national program reviews, for instance, to also identify and prioritize which sectors, which stakeholders in the country are important to be engaged. So for instance, it could be that you would want to prioritize, given limited resources, the top 5 sectors in the country which have maximum contribution to TB information advocacy or TB prevention and care. From global data that was just released 2 days ago, we see, for instance, that for advocacy purposes, it's the Ministry of Education. Most countries prioritize. The Social Development Ministry is also a priority that we've seen across countries globally. That is important for the provision of social benefits. And we've seen the Ministry of Labor, the Ministry of Justice, and others that have been prioritized by countries where the contribution is there to actual rollout of TB prevention and care services. So again, this depends on your country perspective, and assessment will help to prioritize this. And then next steps can be taken to invite these sectors to the dialogue. Also, depending on whether you have a large private sector burden, countries like Bangladesh, India, Indonesia, for instance, private sector, even in Africa, Nigeria, for instance, there's a big private sector, they should be around the table. And also civil society, which is very important. You're seeing TBEC here, which is, civil society led organization also taking the lead. So it really depends on this. I'll stop there and then turn to other countries to share their personal experiences.
Да, мы призываем Украину, Бангладеш и
And now I would welcome Ukraine, Bangladesh, and Brazil to share their experience if you have anything to add.
Okay, thank you. I think, okay. In Brazil, we have the experience of implementing MAF-TB. So the first step, I think, is conducting a detailed diagnosis of the tuberculosis situation in the country, because it is important that you include epidemiological data, health infrastructure, and existing policies in your country. This will help you a lot to understand the specific needs and challenges in tuberculosis control in your country. So second point is identify and involve, like Monica said, all relevant sectors such as health, not only health, but social assistance, education, and other civil society organization, because the intersectoral collaboration is essential to address the, for example, the social determinants of tuberculosis in the implementation of MAF. And other important point in Brazil is establishing forms, types of monitoring and evaluation to track the implementation of MAF-TB, and measurable indicators to progress against the established goals. This can include, for example, data collection on case, treatment, and outcomes. And finally, I think that to a robust implementation MAF in your country is seek partnerships with international organizations and, of course, the private sectors to support the implementation of MAF. These partners can provide resources, expertise, and logical support. Thank you.
Спасибо большое.
Thank you so much. Bangladesh, Ukraine, would you like to jump in and add something? If not, we will move on. Responding to questions. So two more questions left. Colleagues, please respond to this really quick.
Ukraine is interested, then I can. I really want to add one thing that this is all about interest. Any organization, any ministry, or any divisions can take interest, but you have to align with your interest to be a reality. Right at the moment, I'm working on that, as I'm assigned to do this. I'm working on the diplomatic community here in Bangladesh, and I have a plan with my colleagues in the ministry and also with WHO team here. And I will, make a pilot project on the diplomatic community here in Bangladesh who are working here and also interested to attend, also interested to give their sample participation with the TB program, TB control program. So that would be great if everyone can take interest in different portion of the society. That will really help to engage, diverse kind of planning and execution. Thank you.
Спасибо, госпожа Милки. И мы переходим к следующему вопросу от...
Thank you, Ms. Milky. And the next question is from Ghislaine Maybelung. Ghislaine, over to you for your question. And please mention whom of the speakers you are addressing your question to.
Ghislaine Maybelunga.
Miss Laine Maybelunga.
Merci beaucoup. Vous m'entendez?
Thank you. Can you hear me?
Okay. Bon, moi, c'est Ghislaine Adelwanga,
I am
effectivement.
Ghislaine from DRC. I am director of ELENA, an organization fighting against tuberculosis. My questions is directed to the person who talked about the 10 step before the launching of MAF. In DRC, we already have an institution which is responsible, and the president of the country is the first responsible of that institution, and it is an institution that is focused on a multisectoral approach to HIV. It already has like many stakeholders, and the institution has been in place for about 10 years now. You talk about TB, HIV, in MAF-TB. Sometime I heard TB, HIV. So I would like to know if we should necessarily have MAF-TB that is separated from an HIV institution that exists and which is already engaged in multisectorial approaches, because we already have some results from the work of this multisectoral institution focused on HIV. So is there a possibility to leverage on that institution for MAF-TB?
Отличный вопрос. Спасибо вам большое. Возможно, коллеги из ВОЗ...
Well, thank you for this great question. And maybe our colleagues from WHO would comment on what is the WHO's approach on the establishment of a coordination mechanism, of an MAF mechanism. And I can share our opinion about choosing the CCM mechanism for MAF. Actually, you partially already answered the reasons that country might use to use CCM as MAF. But now over to my colleagues from WHO, maybe Monica, and then Saihat, and then Yana.
Наверное, Юля, я предлагаю Монике на глобальном уровне, и, может быть, потом
maybe Monica should start presenting the perspective from the global level, and then I will share about the situation in the region. Monica?
Thanks so much, Sayohat, and thanks, Julia, and indeed, a very excellent question, and this is extremely context specific. It depends on the country to see whether there is an appetite in the country to have only a TB-specific multisectoral leadership mechanism. Now, this may indeed be the case, and that would be fantastic. That would be ideal scenario, that the government leadership decides that tuberculosis is a priority, and there is a multisectoral high-level mechanism in place. This is the case in countries like India, in Indonesia, for example. Now, today you heard from Melissa from Brazil. They have a multisectoral mechanism in a high-level mechanism launched by President Lula, but as she presented, it's not just TB, it's TB and other socially determined diseases. So, it's in combination of that. Similarly, in Vietnam, it was, again, a mix of, different disease areas that were brought together when the multisectoral mechanism was formed. Now, in a country in Africa where there's a high TB, HIV co-infection burden, for instance, if there is this high-level leadership-led mechanism that can be leveraged and to convince governments to prioritize TB and to have this mechanism prioritize MAF-TB, then this indeed can be taken forward. So again, coming back, there's no one size fits all. It really depends very much on the country context. I've given you a few examples, Ghislaine, but for your country, DRC, I think this is something that all stakeholders need to be brought together and to see the leadership to discuss. Over to you, Sayohat.
Thank you very much, Monica. I hope you can hear me. I fully support Monica, and I'm repeating myself, I mentioned it during our meeting, that I like this framework very much, because this is a general framework and it gives possibility to countries to adapt into their context. So if to tell about the context in Euro region, our country, member states, they prefer to use the existing mechanisms rather than to create the new one, because actually the same actors at the end of the day will be engaged to this coordination. This is the first point. The second is that it's good to use the existing mechanism because it ensures the people-centered approach. because we will be looking at the person as a whole, but not divided it to diseases. And in our region, we have a country coordination mechanism, which was developed to implement a Global Fund project. And as Jana mentioned in her presentation, then in almost in all countries, the function of this committee was expanded to coordinate the health in overall, health system overall, and TB and HIV and malaria in particular, and not only monitoring the implementation or planning and monitoring of the Global Fund project, but monitoring and the planning and implementation of other donors, and plus the national programs overall. So what can I say? That it really depends on the context, but in your particular case, if the HIV coordination mechanism, it shows its effectiveness, of course, it's better to use that mechanism. And if you see in the WHO operational guidance on adaptation and implementation of MAF-TB, we have requirements to how to establish that coordination mechanism and what should be under this mechanism functions. So you can use that, you can expand its role and functions, and to use this existing mechanism. Thank you.
Спасибо большое, Саяхат.
Thank you very much, Sehat.
Яна, вы хотите что-то добавить?
Maybe Jana wanted to add something else. Maybe you have some other insights on top of what you already mentioned. Why you choose CCM? Well, probably it all depends on the objective. I mean, this mechanism for multisectoral cooperation was set up to engage the partners who are really capable of having an impact on TB program. And our experience from Ukraine tells us that we are a country with high burden of TB and HIV. And for us, one of the ways of addressing HIV was addressing TB and vice versa. So for us, the country coordination mechanism was a good fit for a country with high burden of HIV and TB. Also, it's important to have a look at the efficiency of the existing CCM, because we looked at it and saw that it included most representatives of the ministries and agencies that were important for comprehensive TB response. So whenever someone is considering which mechanism to choose, people should start with the objective that they should choose, and maybe they should have a look at the nosologies that are present in their countries. They should have a look at whether this existing mechanism already has all the stakeholders. If it doesn't, you can introduce somebody else and you can expand its framework by means of other decision makers from the important stakeholders. So our experience from Ukraine tells us that after several rounds of discussions, we saw that for a country which has a high burden of both TB and HIV, it would be expedient to use the existing CCM, which was updated several times over the course of the past years. Because for us, it's important to ensure the comprehensive cycle of the multisectoral framework as stipulated by WHO. So we saw that at the CCM level, we can ensure both decision-making and planning and implementation. And that's why we chose this framework and instrument. So there's no universal one-size-fits-all solution, and it should all be decided by each country depending on their national specifics. But I'm sure that if a country makes a political decision to set up the MAF, they will find the best modality that works for them, and WHO will help them adjust and adapt the recommendations and guidelines. Thank
Спасибо
you.
большое. Я вижу, что руку держит Бертран Кампуэр. Вы очень
I
долго
see
ее
that
держите, поэтому
Bertrand has been
я прошу
holding
вас очень
a hand up for a
быстро
long
задать
time,
свой
so could you just ask a
вопрос, только вы
question
проявите
because
настойчивость,
we are running late
пожалуйста.
and you've been.
No, it's a new one.
Okay, it is a new hand.
Да, Бертран, пожалуйста.
Yes, can I? Okay, thank you. It's just to share for 1 or 2 minutes draft TB experiences because Yiwang from WHO share a link on the chat group with implementing material and best practice. And draft TB is part of those best practice on the link Yiwang share. Because actually we also implement the MAF-TB in 12 countries in West and Central Africa. And what I can say is that the first step for us was, number one, to use the material provided by WHO. And then the second step was at country level to set up committees, including WHO country office, the NTP, and some of the key stakeholders. And then we analyze the data. Actually, what is the most important is that the recommendation, for example, in terms of the 4 components of MAF-TB, for us, civil society engagement was very high. But the challenge was in terms of implementing some of the key recommendations, whether from the UNHCR level, political declaration, whether of some of the key components of the NTB strategy. And then we include parliamentarians as part of the advocacy process to make sure that the 12 countries involved can be more faster in terms of implementing the engagement, the country to reach most of the people with high level diagnostic, national domestic financing. And later today, we have a process where draft TB implements a regional dashboard where we can monitor progress made by countries in terms of their engagement. And then the last step is now we put a specific focal point in each of the countries to collaborate with the NTP and national stakeholders to push for countries to meet their engagement. More information can be available on our website, drafttb, drafttb.org. Thank you, Hoba.
Бертран, спасибо большое за такую детальную информацию о том, каким образом внедряется у вас на уровне региона.
Detailed insight into how you're doing that at the regional level. Dear colleagues, thank you for your questions, thank you for your comments, and thank you for being active. Thank you.
Что полученная информация будет полезной для вас.
Thank you for being active. We hope that the information was important and insightful for you. We thank our distinguished speakers for the shared expertise, and we thank our interpreters for helping us understand each other. Now you should see a link to the next meeting posted in chat, and we're also pulling it up on our screen. The next meeting will be about mobilizing political will and resources, because some of the questions were about that in our chat. So if you're thinking about how to mobilize political will and resources to strengthen the intersectoral response to TB, we have a meeting planned for December 11 at 10 a.m. Central European Time, and we invite you to register using the link that you see in chat and on the screen. And I also see the QR code that you can use. So you might as well pull up your cell phone and use it to navigate to the registration landing page. Thank you once again for participation, because together we will definitely win over TB. And see you next time. Thank you. Take care.
Спасибо, всего хорошего.
Спасибо большое, коллеги. До встречи, до свидания.
Thank you.
Thank you.
Thank you. Bye-bye.
Yeah, bye bye.
Thank you.
Merci.
Vatran, bye.